Hi. Stroke occurs due to the decrease or blockage in brain's blood supply, preventing the brain tissue from getting its essential oxygen and nutrients. This could lead to death of brain cells and brain tissues. So let's talk coming up. How do you do, guys? This is Surendran's YouTube channel sharing you a lot of inspiring and fascinating facts. If you're already here, please consider subscribing and click on the bell icon for future notifications. Well, let's talk. Before we get deeper, we need to know what is stroke. Well, stroke occurs when blood vessel in the brain ruptures and start to bleed, or whenever there is a blockage in the blood vessel in the brain. The rupture and the blockage will prevent the blood which carries oxygen from reaching the brain's tissue. Without essential oxygen and nutrients, the brain cell and brain tissue start to damage and begin to die in minutes. There are three types of strokes. First one is ischemic stroke, second one is hemorrhagic stroke, third one is transient ischemic attack, which is known as TIA. First is ischemic stroke. Ischemic stroke is a common stroke that happens among all people. This is because the blood vessel in the brain gets blocked by a blood clot that formed inside the blood vessel. The second is hemorrhagic stroke. Hemorrhagic stroke occurs due to the blood vessel in the brain ruptures and start to bleed. This can be due to high blood pressure, trauma from car accidents, overuse of blood thinners, anticoagulants, and also the abnormal formation of blood vessels. These are the results of aneurysms and also arteriovenous malformations, or which is known as AVMs. The third is transient ischemic attack, or which is known as TIA. This is called as mini stroke and persists for a short period of time. This occurs because the blood supply to the brain is inadequate for a short period of time. This is not a serious matter and persists for a short period of time, and the symptoms will resolve without any further medications. When it comes to symptoms, pay more attention to the people that might have stroke symptoms. Efficient treatment should be given in correct time to prevent any unnecessary further medical complications. Well, the first symptoms is severe headache. A sudden severe headache will be accompanied by dizziness and vomiting whenever you start to walk or you start to open your eyes. Second is trouble when we walk. When we walk, we will lose our coordination and we cannot walk on a straight line. You may experience dizziness when you walk and you won't be able to open your eyes when you walk. Third is the numbness of face, arms and legs. You might develop numbness on your face, arms and legs. Whenever you feel in such way, try to raise both of your hands over your head. If one of your arms start to fall down, it means you have the symptoms of getting stroke. And also, when you start to smile, your one side of your mouth starts to drop. The fourth is having difficulty in speeches. You might have the trouble to understand what others are saying, or even you will find it difficult to convey what you're trying to say through your mouth. Stroke is a medical emergency and need an immediate treatment before a correct treatment is given. This is because the treatment for hemorrhagic stroke and also ischemic stroke is different. For ischemic stroke, the treatment starts with breaking down the blood clots and also preventing the formation of other blood clots. The doctor will start to give aspirin. Aspirin is a drug that acts as a blood thinners. Blood thinners is actually a drug that have a purpose of slowing down the formation of blood clot or prevent the formation of blood clot. In other efficient way, a liquid drug which is known as tissue plasminogen activator, or known as TPA, will be injected in the stroke patient body. However, the TPA injection should be given within 4.5 hours after the patient start to show stroke symptoms. In some severe cases, surgery is required. For example, is carotid endarterectomy. Carotid endarterectomy is a surgery that opens a carotid artery that's situated over here to remove the fatty plaque that could travel to the brain. For hemorrhagic stroke, the treatment is to control and prevent the bleeding inside the brain. The treatment for hemorrhagic stroke starts with taking the drugs to stop the bleeding inside the brain and also reduce the pressure inside the brain. Not forgetting to control the overall blood pressure that causes the bleeding inside the brain. This blood pressure is controlled to prevent the patient from having seizures and also any sudden constrictions of the blood vessels. If the hemorrhagic stroke patient is already taking blood thinners anticoagulants such as warfarin, they can receive treatment to counter the blood thinners. Well, finally, I'm going to tell you how to prevent yourself from getting stroke. First way to prevent yourself from getting stroke is don't smoke. If you're already a smoker, quit smoking. Smoke will thicken your blood that have the possibilities to form a blood clot inside your artery. Second is don't take excessive alcohol drinks. If you're already an alcohol consumer, try to consume your alcohol drinks in moderation. This excessive alcohol intakes will increase the blood pressure of yourself. Third, keep your weight at healthy level. Being obese or overweight will increase the risk of getting stroke. Eat a balanced diet food every time and also eat the diet which is full of fruits and vegetables. Fourth is be physically active. Being physically active will make you sweat, which burns excessive fats inside your body. If you burn the excessive fats from your body, you actually helping your body from the formations of fatty plaque that could block the artery inside your brain. Fifth and the final is go for regular checkups. Go and have a regular communication with your doctor. Go and consult with your doctor to modify your lifestyle if you find your lifestyle is not good and can bring you into bad disease. Discuss your medication options with your doctor. If you have any problem regarding your health, address it to the doctor and get effective steps to manage your problems. Dear lovable friends, I think I have made it short and simple regarding today's topic. Share my video to your friends and family or anyone that you love. Share them and let them know about the symptoms, the dangers of having stroke. Suggest me a topic for my next video and drop them in the comment section. Like my video if you like it. Share my video if you like it. We share the knowledge among the community. We rise by lifting others. Thank you. Thanks for checking out this video and don't forget to subscribe for more videos like this. Until next time, keep crushing it and we will talk soon. Bye.